Okay, as I told you earlier, today we are having the two lectures and we are planning for the very simple last chapter or last beat from your unit number 5, and today we are ending with your NDDS syllabus. Then also you are having the quiz on your unit number 4. Okay, quiz number 2nd. Understood today? All of you get idea? Then I will upload the quiz link on the Google Classroom and you have to solve it. That quiz is on the unit number 4. Then today we are starting with the simplest bit, much more simple chapter, which is having the very small coverage considering your syllabus, and which is having the maximum importance. अंडरस्टूड म्हणजे छोटा आहे म्हणून काही इम्पॉर्टंट नाही असं काही नाहीये, बट दिस चॅप्टर इज मच मोर इम्पॉर्टंट बाय कन्सिडरिंग युअर सिलेबस पॅटर्न. Then this is also important for your community, then the day-to-day life, after your future life. This uterine intrauterine devices are the one of the important concept. म्हणजे बऱ्याचदा when we are observing at the surrounding, it will found that many of the peoples are having the misconceptions, and as such we are the medical persons, so we have to be cleared with our profession, and we are a professional persons, so we are communicated many times, we are familiar, many times we are talking on this some of the concepts which are maybe hidden by the community. Understood? Why? Because we are a medical person. So now you kept in a mind that you have to make your mind much more clear cut. In that mind there is a no any differentiation between the male, female. Why? And we are a medical person. Understood everyone? The background knowledge about this is you don't get differentiate the means male, female, that are organisms. Okay, as such we are all medical persons, so we are having right, or we are having the need to talk in a community regarding the any concepts which deals with the health of the human being. Understood? So we are starting with your last part, that is the intrauterine devices. All of you are aware about what is meant by intrauterine devices, but we are don't aware about the use. We are unaware about its mechanism, how they are showing its action. We are unaware about their manufacturing. We are unaware about their insertion. We are unaware about their removal. Means we are only known about this word, that is the intrauterine devices, but exactly what it is, that we will see today. Understood? So we will starting with this bit. We came to know that basic introduction. Why? What is the need to make that intrauterine devices? What is the need to use that intrauterine devices? The simple name of the intrauterine devices, it is simply having the synonym, that is the IUD. Intrauterine devices दुसरं नाव काय आहे? IUD. आणि नावच सांगते. What is the intrauterine devices? Means these are the devices that are used into the uterus. Understood? Then what is it? The intrauterine devices are many times the T-shaped device. असं नाहीये की T shape असतो, but many times it is a T-shaped device that are majorly used for the birth control. Clear? And which is designed for the insertion into the human uterus. Okay, sorry, female uterus. Clear? Get idea? What is the intrauterine devices? Intrauterine devices are IUDs, which are having the small, specifically T-shaped devices, which are made for the insertion into the female uterus. And why it is used? For the birth control purpose. Understood everyone? Here it is a one of the design of the Lipan device. Some of the name of this name is a Lippers loop. Lippers loop. It is a name of this device. It is not actually looks like a T shape, but it is a also IUD. Then 99% of the effective to prevent the pregnancy. that IUD is having the 99% chances to prevent the pregnancy. It will be having the use through the 3 years to the 10 years. Clear? And it is a completely reversible process. Means once you want to stop the duration, then you have to remove that property and then you are planning for the child. Clear? Then IUD have the attached with the thread or the tail which projects into the vaginal after the insertion. Means each and every IUD, if you saw any design of the IUD, then each and every IUD is having the tail. Clear? And to that tail there is a thread is attached. Why? It will make easy to insert into the vagina and the removal from the vagina. Clear? It is a structure. Then what are the types of IUDs? Mata types of IUDs, or what is the classification of the IUDs? Specifically, the IUDs is classified or having the types which is divided into the majorly two groups. First group, it is a non-hormonal IUDs, and second group, it is a hormonal IUDs. त्याच्या नावातच आहे. What is the non-hormonal? These are the devices which are not contain the hormones. मग काय यूज करायचं? These are having the different mechanism. These are containing the different drugs. Understood? And hormonal IUDs, that is contain the hormones. All of you understood? Anyone have any doubt? Then what is the non-hormonal IUDs? The non-hormonal IUDs which is not release the hormone. Clear? Non-hormonal IUDs जर नॉन शब्द वापरलाय म्हणजे त्याच्यामध्ये हार्मोन नाहीये. मग हार्मोनच नाहीये तर रिलीज करतील का? So these are not releases the hormone. Then non-IUDs is non-hormonal IUDs are having the sperm killing capacity. They are having the different mechanism. मग कसं sperm ला kill करतं वगैरे, that we will see in a next section. Then the first generation IUDs doesn't release anything. Okay, when we are started the first time that IUDs, Namrata Asbe. Namrata Asbe, am I audible? What is going on? Final year. All of you, first of all, start your video within a 1 minute. Fast. Okay. Then non-hormonal intrauterine devices are the sperm which are non-hormonal IUDs but having the property to kill the sperms. Then first generation IUD doesn't release anything. मग फर्स्ट जनरेशनचे जे आययुडीज होते तर ते काय करतायत तर कोणतीच गोष्ट रिलीज करत नाहीये. क्लिअर? बट हॅव्हिंग द डिफरंट मेकॅनिझम टू ऍक्ट ॲज अ बर्थ कंट्रोल. देन the example of the first generation devices are the lipus loop that we are seen earlier. Then next it is the second generation IUDs which is only release the copper ion. Okay, means they काय करतायत, they are releasing the copper and they are showing their birth control property. Then next the example of the second generation derivatives are the copper 7 mlcu 250 mlcu 375. These are the capacity to release. Okay, then the second generation is suitable for the nulliporous women, means the woman which is having the post generation capacity, that and which is having the any chance to accept the sperm and convert it into the embryo. For that woman, the second generation derivatives are the suitable. These are the usual shape of the IUDs. Usually, as I told you earlier, the IUDs are having the T-shaped devices, but still these are the further shapes are designed to make more feasibility. But nowadays, specifically T-shaped devices is having the more importance. म्हणजे मोस्टली कसं असतं, एखाद्या सायंटिस्टने एखादा रिसर्च केला, दे आर फाइल्ड द पेटेंट, त्यानंतर त्याचे इम्पॉर्टन्स लक्षात येतो आणि मग एक्झॅक्टली दॅट स्ट्रक्चरचं आपण नाही बनवू शकत. दॅट टाइम वी आर प्लॅनिंग टू डिझाइन द डिफरंट स्ट्रक्चर. ओके, देन these are the inexpensive devices which are the simple and the long term use. म्हणजे additional, what is the addition of the IUDs? These are the inexpensive conditions which are the simple and the long term use, and they can able to remove at any time. आणि ते जे डिव्हाइस आहेत तर ते एनी टाइम आपण रिमूव्ह करू शकतो. आय एम हॅव्हिंग द व्हेरी शॉर्ट व्हिडिओ विच विल बी वेल एक्सप्लेन्ड व्हॉट इज मीन बाय IUDs, why they are using, we are using the IUDs, and what are the advantages of the IUDs and how they are inserting. Okay, it is a short video. I will first share that video, then you are able to understood. Okay, then second type, it is a non-medicated IUDs. पहिला बघितलेला टाइप कुठला होता? Hormonal, non-hormonal IUDs, and second type, it is a non-medicated IUDs. These are the IUDs not contain any therapeutically active ingredient. म्हणजे नॉन मेडिकेटेड IUDs आहेत तर त्याच्यामध्ये काय असतं तर कोणताही थेरॅप्युटिकली ऍक्टिव्ह इन्ग्रेडियंट नसतो, म्हणजे ड्रग नसतो त्याच्यामध्ये. दीज आर प्रॉमिनंटली मेक द मटेरियल ऑर द प्लास्टिक रिंग्स ऑर द कॉइल्स. ते कसे असतात तर ओनली पॉलिमर्स पासून बनलेले डिव्हाइसेस असतात. मग काय यूज करतो आपण तर these are the rings of the stainless steel and having the mechanical effect on the uterus leading to producing the effect like a contraceptive. म्हणजे as such त्याच्यामध्ये कुठला ड्रग नसतो, त्याच्यामध्ये कुठला हॉर्मोन नसतो, ते कुठलाच ड्रग रिलीज करत नाही, मग तरी पण ते कसं कॉन्ट्रासेप्टिव्ह म्हणून ऍक्शन दाखवतं. दॅट वी विल सी इन अ नेक्स्ट पार्ट. These are the plastic ring, also act as a mechanical barrier for the sperm and the eggs so they do not fuse. Means that devices that will not release any drug, that will not release any hormone. How they are showing its action? By providing the barrier, mechanical barrier, which prevent the sperm and the egg to fuse in the uterus and convert that into the embryo. Clear? The plastic rings are made up from the sterile material such as the polyethylene and the propylene polymers. Clear? Then we will see the short video, then we will discuss the mechanism. म्हणजे आतापर्यंत जे बघितलं की what is mean by IUD, how it looks like, how it will be using or how it will be categorized. Then we will see first of all short video, then we will define the mechanism of action. Okay, screen is visible. Anyone?
Yes, ma'am.
Okay.
A series of events called the menstrual cycle happens about once every month to prepare a woman's body for pregnancy. Changing levels of natural chemicals in the bloodstream, called hormones, control these events. The reproductive organs affected by these hormones include the vagina, cervix, uterus, fallopian tubes, and ovaries. The ovaries produce two main hormones called estrogen and progesterone. As the level of estrogen begins to rise, it causes the normally thick mucus inside the cervix to thin out. Estrogen also triggers other hormones to cause one of the ovaries to release an egg. This process is called ovulation.
Here they told about what is a normal procedure for the birth, giving the birth procedure. Okay, means generation of the embryo. That our ovaries is releasing variety of the hormones. Also, it is releasing the egg. That egg is taken by the fallopian tube. and then that egg is transported toward the uterus. If there is an entry of the sperm is there, then that fusion of the egg with the sperm resulting into the generation of the embryo. Then how that IUDs will prevent this fusion, we will see.
If a woman has sex during this time, a man's reproductive cells, called sperm, can pass through the thinner mucus to fertilize an egg. In the uterus, estrogen causes the lining to thicken, which prepares it to receive a fertilized egg. Rising progesterone levels cause glands in the lining to release fluid that feeds the fertilized egg. Progesterone also causes the thinned out mucus in the cervix to become thick again, which prevents sperm from passing through. If an egg hasn't been fertilized, the levels of both estrogen and progesterone begin to fall. This drop in hormone levels causes menstruation, a process where the uterus sheds its inner tissue lining and blood through the vagina. An intrauterine device, or IUD, is a birth control method consisting of a soft, flexible T-shaped device with a thin string on the end. There are two types of intrauterine devices, hormonal IUDs and a copper IUD. To prevent pregnancy, a doctor places an IUD inside a woman's uterus with the string hanging down inside her vagina. Both types of IUD cause mild inflammation of the uterine lining, which releases immune cells and chemicals that kill sperm.
After the placing the IUDs inside the uterus, there is a inflammation takes place. Why? Because it is a foreign material. आपल्या बॉडी साठी काय आहे? IUDs, it is a foreign material. Then our body start to generate the WBC. आपल्याला माहिती आहे अँटीजन अँटीबॉडी रिएक्शन होते. सो आपल्या बॉडीसाठी ते काय आहे? अँटीजन आहे. आपली बॉडी काय करणार आहे? त्यासाठी काहीतरी तयार करणार आहे. दॅट इज अ WBC. अँड दॅट WBC इज मायग्रेटेड टुवर्ड द युटेरस. म्हणजे त्या युटेरस मध्ये काहीतरी वेगळं आहे हे आपल्या बॉडीला कळतं. अँड दॅट विल बी मायग्रेट टू दॅट पार्ट. And there, if there is a sperm is there, then that that WBC will kill that sperm, and indirectly it will showing the action like a contraceptive. See here, that will be killing the sperm.
Hormonal IUDs also contain a synthetic type of progesterone called levonorgestrel. Levonorgestrel mainly prevents pregnancy by thickening the mucus inside the cervix, which prevents sperm from entering the uterus.
Some IUDs are releasing the progesterone. Some IUDs will release the progesterone. That progesterone will prevent this, which causes the thickening of this area. म्हणजे एक secretion तयार करतं in that area, cervix area. That thickening will prevent the entry of the sperm inside the uterus. Clear?
It also prevents the uterine lining from thickening, so it is less likely to receive a fertilized egg. About a month after it's
clear, everyone? Okay, then we will see the mechanism. Already you are seeing the animated video, so it will be quite easy for you to understand the things. So we will see the mechanism. What is the mechanism? The IUDs causes the local inflammation of the uterus wall after the 24 hours after the insertion. Insertion केल्यानंतर 24 तासानंतर काय होतं? तर uterine device inflammation व्हायला स्टार्ट होतं. That inflammation attracts the WBC. That WBC is enter toward that uterus, and there is a release. That WBC will release the toxic material. That toxic material is providing the toxic effect on the sperm, and there is a preventing the fertilization of the sperm. Clear? खूप simple mechanism. अलग understood? तिथं ड्रगच पाहिजे, ड्रगनीच ऍक्शन प्रोड्यूस केली पाहिजे असं नाही. By this way also it will be causes the prevention of the fertilization. Then anti-fertility action of the copper T. Okay. पहिलं काय होतं? नॉन ड्रग किंवा नॉन हॉर्मोनल It is also non-hormonal, but it will releases the copper. Clear? The highly concentration of the copper, it is a cytotoxic. म्हणजे कॉपर जास्त अमाउंट मध्ये असेल तरी पण काय असतं ते सायटोटॉक्सिक असतं. कुणावरती सायटोटॉक्सिक असतं? ऑन द स्पर्म. So the copper is having the spermaticidal effect, and that will be inhibit the progesterone and lesser the effect of estrogen. म्हणजे also copper काय करतं? एक तर स्पर्मला पण किल करतं आणि सेकंड द कॉपर विल इनहिबिट द प्रोजेस्टेरॉन and then it will be act as a anti-fertilized agent. Then next it is a progesterone. A novel progesterone releasing IUDs are available in the market. सध्या मार्केट मध्ये काय आहे तर प्रोजेस्टेरॉन containing the IUDs are there. What are the advantages? As we are seeing in the video, that progesterone containing IUDs causes the thickening or releasing the viscous mucosa up to the cervix region. Mute everyone yourself. Harshali Chavan, mute yourself. Am I audible? Then that device is having the solid polyvinyl acetate at the side of arm. म्हणजे ते कॉपर टीचे जे टी शेप असतात कडेचे जे टी शेप्स, that IUD चे जे टी शेप आहेत तर that T shape is containing the ethylene vinyl acetate, and there the hollow core in that the progesterone is filled. That will be releases the progesterone up to the 38 mg at the totally 65 mg per day. ओके, टोटल त्याच्यामध्ये 38 mg ऍड केलेलं असतं आणि त्यातलं 65 mcg ओके रिलीज होतं पर डे. म्हणजे ते भरपूर दिवस चालतं. दॅट इज द 12 month. क्लिअर? Then that will be releases the progesterone inside the uterus, which will be causes the releasing the viscous secretion at the cervix region. That viscous secretion prevent the entry of the sperm inside the uterus, and hence there is a prevention of the pregnancy. These agents is having the variety of the advantages, and which will be increases the the effectiveness, which will be lower the menstrual blood flow and decreases the dysmenorrhea. म्हणजे ऍडव्हान्टेज काय आहेत? दॅट हॉर्मोनल आययुडी चे किंवा नॉन हॉर्मोनल आययुडीज, टोटल आययुडी चे ऍडव्हान्टेजेस काय आहेत तर ते increases the effectiveness. Also they will releases the or lowers the menstrual blood flow. If during the menstruation, if there is a heavy blood loss is there, in that cases, if the IUDs are placed to that woman, then after the menstruation there is a low blood flow is there. And next it is also decreases the dysmenorrhea, means if there is a changes the frequency of the menstruation, that will be get cleared inside the when anyone is uses the IUDs. Afterwards, after the removal of the IUDs, the menstruation comes the regularly. Then what is the disadvantages? मग त्याचे disadvantages काय? It is needs to replace yearly. Okay, it needs to change. Next is a sometimes the intrauterine bleeding is also there if it is not kept properly, and sometimes it is a ectopic pregnancies. What is the ectopic pregnancies? Many times it will be happen that the ovum is not released to the uterus section, but if the small or minute amount of the sperm is entered inside the uterus, then where at exactly egg is there, their fertilization takes place. Clear? म्हणजे तयार झालेलं जे काही आहे फर्टिलाइज्ड एग, ते जे काही अनफर्टिलाइज्ड एग आहे तर ते नॉर्मल प्रोसेस मध्ये युटेरस मध्ये पडतं आणि त्यानंतर त्याचं फर्टिलायझेशन होतं. बट जेव्हा कॉपर टी तिथं प्लेस असते त्यावेळी त्या एगला खाली यायला जागा नसते आणि ते एक तिथंच कुठं अडकून राहतं. तिथपर्यंत जर स्पर्म गेलं तर देअर फर्टिलायझेशन टेक्स प्लेस आणि मग ते अननेसेसरीली कुठल्या तर वेगळ्या सेक्शन मध्ये मोस्टली फॉलोवियन ट्यूब्स मध्ये प्रेग्नन्सी बेअर होते. इट इज अ मेजर डिसएडव्हान्टेजेस ऑफ दिस और आययुडीज. So most of the time it is not preferred if it is a first time usage for the contraceptive purpose. Clear? Many times there is a needs to cut the fallopian tube, so it is a very complicated procedure, so it will not preferred for the first time usage of the contraceptive devices. It is the actual structure of the progesterone microcrystal as we have studied earlier. At the tail region it is a contain the thread. It will be helpful for the easy placing and the easy removal after the use. Then it is also called also containing the linosterol releasing the IUDs. Linosterol, it is a similar as that of a progesterone, same action dakhota as that of a progesterone, but their dose is different. Clear? प्रोजेस्टेरॉनचा सिंथेटिक हॉर्मोनचा वेगळा डोस होता, लिनोस्टेरोलचा वेगळा डोस आहे, बट बोथ आर द स्टीरॉइड्स. द सप्रेस द एंडोमेट्रियम अँड द ओव्ह्युलेशन. हे काय करतं तर एंडोमेट्रियमचं जे काही थिकनिंग असतं तर ते कमी करतं आणि ओव्ह्युलेशन स्टॉप करतं. इट इज हॅव्हिंग द सेम इफेक्ट ॲज द प्रोजेस्टेरॉन आययुडी. इट विल ऑल्सो डिक्रीजेस द रिस्क ऑफ द PID. मीन्स जे काही आपण पहिल्यांदा बघितलं तसं की अननेसेसरीली एग फर्टिलायझेशनचा डिसएडव्हान्टेज ह्या केसमध्ये कमी होतो. मग हाऊ इट इज शोईंग इट्स ऍक्शन? इट विल बी कॉजेस द डॅमेजिंग और द किलिंग द स्पर्म. ऍज सच इट इज अ हॉर्मोन. इट विल बी प्रोड्युसिंग द मोर इफेक्ट and it will be causes the killing capacity to the sperm. Also it keeps the endometrium from going very thick and make a lining poor place for the fertilized egg. म्हणजे हे काय करतं, हॉर्मोनल आयुडीज जे काही थिकनेस असतो युटेरसचा तो प्रॉपर होऊ देत नाही, आणि युटेरस प्रॉपर थिक झालं नाही तर इट विल नॉट प्रोव्हाइडिंग द न्यूट्रिशनल मटेरियल फॉर द फर्टिलाइज्ड एग and there the killing of the egg is takes place. Also it is having the disadvantages like a cramp inside the stomach for the woman. Okay, then what is the disadvantages of the linosterol containing the IUDs? It may cause the non-carcinous growth. It's called as a ovarian cyst which is away on their own. म्हणजे ह्याचा डिसएडव्हान्टेजेस मेजरली काय आहे, कंटिन्युअसली इन्फ्लमेशन होऊन त्या एरियामध्ये काय होतं तर ओव्हरियन सिस्ट होतं. क्लिअर? ओव्हरियन सिस्ट इज वन ऑफ द कॉम्प्लिकेटेड थिंग. So it will be causes the ovarian cyst. Sometimes there is a needs to remove the ovary in such condition. Also the hormone continuously uterus मध्ये hormone release होत आहे, म्हणजे ते काहीतरी साइड इफेक्ट दाखवणार आहे पुढे जाऊन. So it will causes the breast tenderness. Sometimes it is a mood swings is there, headache is there, acne. Okay, means pimples आल्यासारखे होतात, डोकं दुखतं. Then when the side effect is happen, there is a usually affair for the first few months. म्हणजे हे मोस्टली बघायला कधी मिळतं आफ्टर द प्लेसिंग दॅट आयुडी, हॉर्मोनल आयुडी. स्पेसिफिकली हे इफेक्ट कोणामध्ये बघायला मिळतात तर हॉर्मोनल आयुडीच्या यूज मध्ये बघायला मिळतात. देयर इज अ मूड स्विंग इज देयर, बट दॅट इफेक्ट इज ओनली लास्टिंग फॉर द फ्यू मंथ्स ऑफ द फर्स्ट इनिशियल यूज. आफ्टरवर्ड्स इट विल बी केम टू नॉर्मल, बट after the prolonged therapy, the long term जर ते प्लेस केलं, there is a ovarian cyst is a major disadvantage. So the not much followed the hormonal IUDs. Hormonal IUDs शक्यतो प्रेफर करायचे नाही. क्लिअर? then hormonal IUDs also called as a third generation IUDs. मग hormonal IUDचं पुढे जाऊन काय झालं, थोडंसं स्टडी झाला, further research is going on, and then it will be generated as a third generation IUDs. Once placed in the uterus, this type of IUDs, it will release the small hormone like a progestin to stop the sperm reaching toward the egg. Usually it having the 7 days of the insertion and having the T shape. ह्याच्यामध्ये फक्त लिनोस्टेरॉल जो ड्रग आहे that will be replaced with the progesterone. Okay, then overall advantages म्हणजे सगळ्याचे मिळून ऍडव्हान्टेजेस. द कॉपर टी इज इफेक्टिव्ह फॉर द 12 इयर. कॉपर टीचे काय आहे तर ऍटलीस्ट 12 इयर्स साठी ते मोस्टली युजफुल आहे अँड इट विल बी रिव्हर्सिबल. ओके, ओनली 1 out of 100 वुमन्स आर युजिंग द कॉपर टी फॉर द 12 इयर्स अँड बिकम अ प्रेग्नेंट. म्हणजे जर 100 बायकांनी यूज केली असेल तर त्यातली एखादीच वुमन असते की जिला चुकून प्रेग्नन्सी बेअर होते, बट इट इज नॉट. 99% it is effective. The copper IUDs prevent the ectopic pregnancy. Copper IUD चा advantage आणखीन काय आहे तर it will be prevent the एक्टोपिक प्रेग्नन्सी म्हणजे जसं आपण म्हणलो की फॉलोबियन ट्यूब्स मध्ये प्रेग्नन्सी होण्याचा चान्स असतो, दॅट विल बी ओव्हरकम बाय द कॉपर टी. ओके, ओनली कॉपर डिव्हाइस, कॉपरचं जे आयुडी आहे त्याच्यातनं एक्टोपिक प्रेग्नन्सी होत नाही. दिस कॉन्ट्रासेप्टिव्ह इज व्हेरी कॉस्ट इफेक्टिव्ह अँड युजफुल फॉर द ओव्हर लॉंगर पिरियड ऑफ द टाइम. कॉपर टी. Clear. The use of the IUD, it is a convenient, safe, and private. Clear. Then the Paragard IUDs are maybe used by the woman who cannot use the estrogen containing the birth control pills, patches, and the vaginal link, including the breastfeeding woman. Clear. Paragard IUDs are there that will be not contain the drug. That is also useful for the many of the woman which is not wish to take the control pills. Why? Because if that woman is breastfeeding woman, clear, that time it is not possible to take the hormonal pills. Why? That will be carries toward the baby itself. So that next, the IUDs may be inserted immediately following the delivery of a baby and immediately after the abortion. Clear. So it will be feasible for the uterus, no problem, after the immediate birth of the baby or the immediate after the abortion. Some studies of the IUDs is also going on to decrease the risk of the uterine cancer. There is some evidences that IUDs are protect against the cervical cancer as compared to other contraceptive. लक्षात येत आहे, म्हणजे असं नाहीये की if we are using the IUDs then these are free from the cancer. If there is a comparison, if there is a comparison between the another contraceptive methods with the IUDs, that case the IUDs is safe. लक्षात येते, other methods are nothing but the various tablets. That time there is a protection of the uterus is takes place. Then what are the disadvantages of the IUDs? There are many times that disadvantages are the shorter period of the time. म्हणजे पहिल्यांदा जेव्हा इन्सर्शन केल्यानंतर थोड्याशा पिरियड पुरते हे डिसएडव्हांटेजेस बघायला मिळतात. विच आर दॅट क्रॅम्पिंग, पेन अँड द स्पॉटिंग. Then the number of bleeding after the dress slightly higher than the normal, and you may have somewhat increased the menstrual cramp. If the bleeding pattern is a bother for you, then contact to doctor. Means many women are showing the side effect like heavy weight loss. If you are seen around yourself, there is a chances that after the placing the copper T or after the placing the IUDs, you observe that there is a heavy weight loss of the woman. Why it is so? Because that woman is ignored the increase the blood loss. If once during the menstruation there is a heavy blood loss is there, then immediately we need to contact the doctor. There is a chances to misplace of that device. There is a misperception that after the using of the IUDs there is a weight loss is there. It is not actual like that. Why that weight loss is there? Due to the heavy bleed streaming is there. Clear? Once you will contact to your doctor, then there is a misplacement is get corrected and there is a no that much blood fall is there and that health is get regained. The IUDs is not protected against the sexually transmitted infection. Means as like a very other devices like a condoms are there that will be prevent that woman from the sexual infection, that will not protected by the IUDs. Clear? So it needs some of the risky procedure. Then it is a higher initial cost of the insertion. Means insertion of that IUDs is required the technical person and there is a increase the costing in that area. But after the 2 years, it is the most cost effective contraceptive methods. Clear? Then IUDs must be inserted by the doctor, nurse practitioner or the nurse midwife or the physician assistant. Means one of the technical person is needed for the insertion of the that IUDs. Very small percentage of the women are showing the allergic reaction to the copper. That time we need to replace the copper IUDs with the any other type of the IUD. The small percentage of the IUDs may be expelled by the woman of the body within the first few months due to the improper fit. As I told you earlier, sometimes the improper fit is also there. That time we needs to contact with the doctor. Clear? These are the some of the references which are used for the preparation of these notes. Anyone have any doubt? Anyone have any doubt? All of you understood? Fast comment in a chat box. Understood?
Yes, ma'am.
Okay, here we completed your all NDDS section, all your units, all your syllabus with 100% coverage of your lecture. Anyone have any doubt? असा कुठला bit आहे का that you needs to revise? All of you understood whole chapters? We are not skipping a single bit. Our whole syllabus is get completed according to me. If your side any bit is remaining from my side, you may suggest. All of you understood everything? Here we completed our whole NDDS syllabus. Then today we will plan for the quiz. Your quiz link is uploaded to your Google Classroom. All of you have to solve it. फक्त आजच्या दिवसच मी link open ठेवणार आहे. Then afterwards I will close it. Clear?